Hi guys, Dr. Loretta here. So by the end of this video, you are going to know the truth about whether or not you have OCD. I will be going through 5 common traits that people with OCD have so that you know whether or not you have it. And if it turns out that you do have OCD, you do want to stick around to the end where I give you 3 tips on how to treat OCD. For starters, let's diagnose whether or not you may have OCD. OCD is a pattern of unwanted and intrusive thought, obsession, and/or compulsion that gets in the way of functioning and impairment and causes significant distress. I said and/or compulsion because it is possible to possess only obsessive symptoms or just compulsion. Also, these patterns can change over a span of time. These compulsive behaviors are intended to ease the stress and anxiety and perceived threats from not performing this ritualistic behavior, and it just creates a vicious cycle. Of course, with being health conscious, people clean, disinfect their spaces, wash their hands, and none of this is OCD. OCD is when, for the fear of that germ, you wash your hands over and over again until they become sore, very dry, chapped, and start bleeding instead of the typical 20-second rule to hand washing. Or only driving through a certain route, or getting ready a certain way, or moving through your house a certain way because you think that if you don't do that, something terrible will happen. Checking a door or stove repeatedly, like if I check my door before going to bed, there's nothing wrong with that. But I have just locked that door and I go back to check the same door repeatedly over and over again. But I'll warn you, you do not have OCD if you only have this. You have to remember, people that have experienced some type of trauma have the tendency of doing this kind of behavior because it could be a protective factor for them. There are various factors that could cause OCD without any specifically known factor. One of these factors is a family history of OCD or other anxiety disorders, like growing up with a family member that has OCD and seeing them engaging in these behaviors and learning those behaviors from them. Stress. Increased level of stress is a risk factor for any and everything. Traumatic events could lead people to developing these obsessions and compulsions, sometimes as protective measures. Substance-induced. This is developed during or soon after a substance intoxication or withdrawal, or after a medication which produces obsessive compulsive behaviors. For this one, it needs to have been in existence for about a month and not just a one-time thing. As you can imagine, people do very interesting things when they are under the influence of substances or withdrawing from substances. Alcohol withdrawal can come with anxiety-related symptoms, feeling like things are crawling on your skin, twitches, and so on. Or when they are intoxicated, because people can do very interesting things when they are under the influence. Due to a medical condition, from symptoms of physical or other mental health related disorders. This medical condition has to be present with obsessive and compulsive behaviors, with those repetitive behaviors. And some other times, people could present with some symptoms, but not enough to fit any diagnostic criteria. Symptoms of OCD includes compulsive behaviors, agitation, hypervigilance, impulsivity, unwanted intrusive thoughts, ritualistic behaviors, repetitive behaviors with fear, anxiety, possibly depression, and potentially panic attacks. These things are like washing, cleaning, taking a shower, counting, hoarding, arranging, checking and double-checking things, disturbing sexual, gender thoughts, thoughts of harming self or others, excessive concerns with morality, concerns with sexual orientation, ruminating, repeating words or muttering them repetitively, needing constant encouragement and reassurance from others. Mind you, some of these individuals know that these thoughts and behaviors are probably not true, Some others think that there is probability for some truth to it, and there are some that wholeheartedly believe it to be true. Let's take you to the 5 diagnostic criteria per the DSM. Trait 1. Recurrent and persistent thoughts, urges, or images that cause marked anxiety or distress. Trait 2. Attempt to ignore or suppress such thoughts, urges, or images, or replace them with other thoughts or actions, example, performing a compulsive behavior. Trait 3. The obsession and or compulsion are time-consuming, taking up more than 1 hour a day, or causes significant distress or impairment in social, occupational, and other important areas of functioning. Before we continue, if you're yet to, please take this moment to like, subscribe so that you can get other mental health related videos and information, and share with your friends and your loved ones so they can join us on this journey to mental wellness. Trait 4. These individuals feel driven to perform this repetitive or mental act in response to their obsession, or that these rules must be applied rigidly. These acts are meant to prevent or reduce anxiety or distress. Trait 5. All of these traits I have listed cannot be better explained by any other physical or mental health condition or substance use. For example, autism, where there is a presence of repetitive behavior or the need to stick to a strict routine. Here is what OCD looks like. For your information, it could be anything. However, here are common themes with this disorder. 1. Other specified obsessive compulsive related disorder. This includes body dysmorphic-like disorder with actual flaws in which those flaws are clearly visible to others, just that they are excessive and cause significant impairment and distress. This is different from body dysmorphia due to the noticeable flaws. This body dysmorphia can be repetitive behaviors or mental acts in response to their appearance, but not all the time. 2. Body-focused, recurrent and repetitive behavior like nail biting, lip biting, skin picking, twitching, or cheek chewing with repeated attempts to decrease or stop this behavior that causes distress or any type of impairment. Let me walk you through some misconceptions or misdiagnoses that people have of what OCD is. OCD is one of those diagnoses that gets thrown around. I've heard people say things like, my OCD, a little less of your OCD. I'm someone that likes to stay organized and I hate messy spaces. And when I'm fixing up a space, I've had people call me OCD for that. OCD is not what most of you think it is. OCD is not anxiety. It is not cleanliness. It is not being organized. It is not liking your things a particular way. OCD presents with mental suffering with that irresistible urge. Anxiety is not OCD. Anxiety is part of OCD. At this point, you know whether or not you likely have OCD. And if you do, here are 3 tips to help with treating OCD. 1. Medication management to treat the symptoms that you present with. 2. Therapy. With therapy, you get assessed by a therapist who will come up with a diagnosis and individualize your care. If you have a friend, a loved one, a family member with OCD, there are things you must never say to a person with OCD. Things like, just get over it. You're doing this to be a jerk. This is their reality. Their symptoms would not make sense to you, and you don't need it to make sense to you. You just need to empathize with people that experience it. This conversation is to create awareness so that you know how to support people with OCD and you know when to seek help if you're in that category. Even though I went through the diagnostic criteria with you, please get with a professional for proper diagnosis. Good news is that this is treatable. However, I will highly encourage that you seek help if you recognize or identify any of the things I mentioned earlier. The longer you wait to get help increases the likelihood of you developing more severe symptoms and other comorbidities. Talking to a professional is always an answer. You can never go wrong with therapy in the hands of the right therapist.